All right, everyone, we are live.
Thank you so much, everyone, for joining us this afternoon for a webinar on nursing, climate change, and health in Nevada. We're joined by the Nevada Clinicians for Climate Action, who are co-hosting this event with us. Just an introduction for folks who are not familiar with the Alliance of Nurses for Healthy Environments, or ANNE. We're the only national nursing organization focused solely on the intersection of health and the environment. ANNE is a national network of nurses with the core mission of promoting healthy people and healthy environments by educating and leading the nursing profession, advancing research, incorporating evidence-based practice, and influencing policy. Nurses can play a vital role in promotion and understanding of climate change as a health issue, and also advancing practice to prevent and protect against health threats, and in advocating for health protective policies that we know are going to be really influential and really necessary in the wake of the climate crisis. Participating in this webinar will help attendees to build their knowledge, practice skills, and gain a sense of community among nurses working in this sector of addressing climate and health impacts. The Nevada Clinicians for Climate Action are a group of doctors, nurses, pharmacists, psychologists, public health professionals, therapists, students, residents, and other health professionals working for a healthier Nevada by reducing climate change impacts. So today we'll be hearing from Dr. Teresa Watts, an associate professor at the University of Nevada, Orvis School of Nursing, Dr. Joanna Leovi, a family medicine physician, Dr. Brooke Ersland. Dr. Levy is also a member of Nevada Clinicians for Climate Action. Dr. Brooke Ersland, who's a family medicine physician, also specializing in obstetric and gynecological health, and a member of Nevada Clinicians for Climate Action as well. And Melissa Ramos, Senior Manager of Advocacy and Clean Air with the American Lung Association in Nevada. And just for folks, we'll be sharing the link at the end of the presentation in the chat. If you're planning on applying for continuing education credits, you'll be required to fill out a post-test. So we'll be sharing that with folks to fill that out and receive their credits for attendance. And without saving any more time, I'll hand it over to Dr. Watts.
Okay, so just let me share my screen. Okay, so you should see my screen, is that correct?
Yes.
Okay,
Yes.
great, thank you. All right, well, thank you all for that introduction. Today I'm going to share a 12-minute presentation on climate change, the impact to health, and on ways nurses can get involved with climate change initiatives. I want to start us off by saying that there's a lot in society that divides us, including this very topic of climate change. But despite disagreements in society, a shared connection is that we all live on Earth. And so let's start with what unites us, which is the fact that we could all call Earth home. But our home is being threatened. Multiple officials at the UN have described climate change as the greatest threat to humanity. So if we don't begin to take action, our home will be permanently altered. According to the UN, climate change is defined by the words that you see on this screen. And this is a pretty wordy definition, so I'm actually going to break it down for you. In this definition, when they talk about direct or indirect human activity, scientists are actually measuring the effect that humans are having on climate change. The image that you see on the right presents the change in global surface temperature using data representing actual change of what's happening, which is the black line, and simulated data of human and natural change, which are the brown and blue lines. The likely contribution of human-caused global surface temperature increase since the 1850s is about 33 degrees Fahrenheit. This observed warming is driven mainly by emissions that contribute to global greenhouse gases, and these gases are mainly from the burning of fossil fuels for energy, transport, and industrial processes. Now, we as humans have to live, so some of our greenhouse gas footprint is unavoidable. But when we have excess, which we currently do, this is when the Earth experiences an altered composition of global atmosphere. The image on the right shows a disappearing lake. These pictures were taken on 2002 and 2022. Between the years, water withdrawal and drier conditions reduced the amount of water in the Southern Oregon's lake. And there are a lot of observed alterations like the one that we can objectively see in this picture. These examples include sea level rise, melting ice caps, and drought. Then finally, in the definition, when they talk about, in addition to natural climate variability, they're talking about the observed change that is naturally occurring, or what we would expect to see if no humans lived on Earth, which is the blue line on the chart, compared to the effect that we're actually seeing, which again is the black line. All of this is to say that the science of climate change supports that it's real, it's happening, it's human caused, and the effects to the Earth are objectively measurable. I think it's important to note that the healthcare industry is a major contributor to climate change. If the global healthcare became a country, it would be the world's 5th largest emitter contributing to global greenhouse gas emissions. Typical areas of largest impact are highlighted in the gray clouds on this slide. These mainly include energy, water, food, and waste. So our very industry that we all work in and is meant to protect health is also contributing to damaging both human and our planet's health through greenhouse gas emissions. Okay, so now that we've defined climate change, let's talk about how it impacts health. The image on this slide comes from the World Health Organization and presents this overview. Most effects are seen through atmospheric changes such as extreme weather events, air quality, and heat. These changes have led to deaths and injuries, the exacerbation of non-communicable diseases, the spread of zoonotic and vector-borne diseases, mental health effects, and more. The truth is, climate change impacts every disease, condition, or behavior in some way or another. Finally, it's important to note that there are individual and health system vulnerabilities that contribute to who will experience climate change worse. I think, as you might expect, people who are marginalized and the health systems that are resource limited are going to experience the effects of climate change worse. On the next slide, I'm actually going to walk you through this figure by showing you an example of how climate change leads to wildfires and how wildfires impact health. Okay, so starting at the top, droughts are a major driver for wildfires. The image here represents different regions of the world in each hexagon, and it also depicts agricultural and ecological droughts. Yellow hexagons indicate regions where there is an observed increase in this type of drought, and circled here, this is where we are. So with data, we can say that there are increases in agricultural and ecological droughts throughout the world, with some areas more vulnerable than others, and climate change is affecting the risk and severity of wildfires through drought. The exposure pathway from wildfires is air quality from wildfire smoke. There are numerous gases and aerosols that are emitted from wildfire smoke, but the hazard that is most often discussed is particulate matter. There are 2 types of particulate matter called PM10 and PM2.5. The main difference between them is the size. The image here shows you the size of PM10 and 2.5 against a grain of hair and a grain of beach sand. Essentially, both are very small, and when inhaled, particulate matter can travel deep into the lung. When there's a wildfire, there's a lot of particulate matter, and that particulate matter can travel pretty far. Exposure to particulate matter can cause shortness of breath, coughing, chest pain, and fatigue. It can also worsen cardiovascular disease, asthma, and COPD. So the main risks to health from particulate matter are to cardiovascular disease and respiratory health. But researchers are also starting to study some lesser known effects of particulate matter from wildfire smoke. For example, in 2020, researchers from Reno looked into the effects of PM2.5 from the wildfire smoke on COVID-19 cases. These researchers found here in Reno, there was an 18% increase in COVID cases due to PM2.5 concentrations associated with wildfire smoke. This is to say that even though the effects are often due to cardiovascular and pulmonary system, there's really a growing body of scientific evidence linking wildfire smoke to other various health effects. The population groups listed here represent groups of people who will likely experience wildfire smoke at an increased burden. These groups have been identified through epidemiological evidence. Therefore, these population groups may need to be particularly diligent about limiting their exposure to wildfire smoke, and you, as a nurse, might expect to see a rise in hospital admissions among the groups that are listed on this slide during wildfire smoke events. Finally, the last session is to talk about health system capacity. I think from the pandemic, we really learned that the health system is not prepared. Now, preparedness for an infectious disease event is very different from a wildfire event, but there are some lessons learned. And I think one of the key lessons that we learned from the pandemic was that nurses experience burnout and fatigue at alarming rates. And this is important because if climate change is the greatest health threat facing humanity, and if nurses had such severe effects felt during COVID, it's most likely going to be worse as nurses care for people who are dying from diseases caused by climate change. The health system needs to not only prepare for climate change, but also prepare for the effects that will be felt on nurses. By now, I hope you could understand what climate change is and how climate change is affecting health in so many different ways. On this slide, I briefly want to talk about what nurses can do to address climate change. I recommend you start by looking at this figure. Start with what you're passionate about. You may want to start by choosing a population, a climate change exposure, or a health outcome. Regardless of where you start, I recommend that you start in one place. If you try to take on too much, you can quickly get overwhelmed. Next, once you get your starting point, I recommend you take actions in research, education, advocacy, and practice. As a nurse, you're trained in evaluating and critiquing research. So for research, I recommend you do a literature review around your topic that you're interested in. I find PubMed is a great place to look for climate change literature. Just begin to look for literature on how climate change is impacting whatever topic you're interested in. Next, for education, there's a ton of resources out there. At the end of my presentation in the chat, I'll actually put down some of my favorite education resources for you. But one thing I do recommend is that whatever you learn about climate change, I encourage you to educate your fellow nurses about this topic. The reason for this is because researchers have shown that not all nurses are receiving education about climate change in their education programs. For advocacy, I highly recommend you join state or national groups like Annie or Nevada Clinicians for Climate Action. And the reason why is because these groups often have folks who are watching policies, and they'll share ways that you can get involved with policy actions. These actions can range from something simple like adding your signature to a letter, or something more involved like meeting with your legislator. Lastly, for practice, see if your healthcare organization has a sustainability committee. If they don't, start one. Be part of a committee that is committed to reducing your organization's greenhouse gases. You can also try to recommend practice change on a smaller level, like a unit that you work on. To give you an example of a potential practice change that I can see nurses making a huge impact on is waste. Before the pandemic, US hospitals generated 29 pounds of waste per patient per day. And I think those of us who've worked in the hospital or healthcare system since the pandemic, we have seen that waste has drastically increased. Now, not all waste can be avoided, but some can. So a potential practice change around waste can begin by you literally doing an assessment of the waste on your unit. Literally inspect trash bins and see what people are throwing out. Then ask yourself what can be eliminated for more sustainable options. Some common easy switches could be something like the removal of plastic silverware or disposable cups, to metal silverware and reusable cups. You don't need to convert your facility to a zero waste facility overnight, but maybe start with a small idea to get leadership buy-in and go from there. Okay, so I'd like to end at the same place where we started. We all need to live and thrive on this planet. To do this, we must think about our impact, because if we don't, we will be faced with a disaster that is going to permanently change our home. To wrap up our conversation, I would like to ask you to use the chat to answer the following questions. What climate change and health topic are you passionate about addressing? When you think about this question and your answer, you might want to describe the population you're interested in, the climate change exposure, or the health outcome. The reason why I'm asking you to do this is to grow connections among us. No single person can solve climate change, but the collective power of nurses who are working together is a force that is truly powerful. Thank you for listening to my presentation. I'm happy to take questions at the end. And I'll pass it off to whoever's next.
Thank you so much, Teresa. We're going to now hear from Dr. Leovi with Nevada Clinicians for Climate Action.
Hi.
I think you're on mute. Oh,
We're actually going to hear from Dr. Ursland at this point.
oh, thank you so much.
Hi, I'm Brooke Ursland. I'm also co-presenting with Dr. Leovi, Joanne Leovi today. We're going to talk about environmental history and clinician care, and we have no disclosures. Let me just advance. There we go. So environmental history, when we talk about that, we're thinking about what things are affecting our patients in their environment. What are they exposed to? Well, we're going to focus primarily today on wildfire, but hopefully we'll help you identify ways to ask and questions to ask all patients who walk through the door. And then also thinking about ways to prevent things. So the goals of an environmental history is identifying any hazards that they may be exposed to, whether it's a big event like a wildfire or just in their daily lives. And then hopefully helping them avoid or stopping the exposure that may be harming their health when possible. And then talking about preventing disease by minimizing exposure. So how do we, if we know there's a wildfire season, how do we prevent disease if we can figure out how to minimize that exposure in the first place? We want to make more accurate diagnoses and treat more appropriately. So understanding how to take care of these patients, influencing the course of the disease by stopping or modifying current exposures, and also thinking about workplace environmental evaluations on a global level to protect our workers that are more exposed to environmental issues. So we're going to start with poll everywhere. We have 2 questions. So if everyone would text that 22333 number, and then in the message, you'll write my name. There is 2 E's in there. It's Brooke Ursula, and then 505. I'm going to advance the slide, but if you look on the top, it will have still the number to text and then what you put in the message. When you send that message with my name, it will tell you you're in the session, and then you can answer questions. So the first question is, what comes to mind when you think of climate health impacts? So just type anything that you think of when you think about climate and how it impacts health. Somebody put respiratory illnesses can get affected. Give it just a few more seconds, but just think about that too on your own. What kind of impacts do you think climate health? There's lots of things. We think about all kinds of systems, heart systems, all of our respiratory systems, causing illnesses that people may have, making things worse. Okay, I think I may go on to the second question. Oops, keep doing that, sorry. Oh, sorry. Okay, I was having trouble advancing my screen there for a second. I'm so sorry. Let's make sure apologize. There we go. Everywhere. Just going to do this. For the poll everywhere questions, they seem to work a little bit better this way. So the second question is, have you cared for patients impacted by wildfire? A is yes, I have cared for patients directly impacted or evacuated. B is yes, I cared for patients exposed to wildfire. Smoke, just the smoke. And then C is no, I have not cared for anyone impacted by a wildfire. And D is you just don't do patient care. Maybe you're just a learner today. So if you'll just put in A, B, C, or D, and I'll give it a few seconds. And again, just if you want to text that 22333 number, and then that's the message you put in. So I'm just for the sake of time going to scroll. So somebody said that they have impacted taking care of patients. Impacted, I think there probably was a few more results. But just kind of thinking about what your level of comfort with these patients are, and it's okay, we're all here learning, so hopefully we can get everybody a little more comfortable with where they are. Okay, I think I'll be able to now advance slides. So thinking about how do you take an environmental history, as clinicians, we all love mnemonics. So today we're going to talk about an easy way, how you take an environmental history. So our mnemonic we're going to use is CH2OPD2. And that stands, the C is for community, the H is for home, the second H is for hobbies, the O is for occupational, P is for personal, D is, the two Ds are diet and drugs. This is just a framework to think about how we ask patients about things they may be exposed into their environment, whether it be something out in their community, whether they have some kind of occupational hazard. So it's a way to ask patients to figure out how any exposures they have. The other thing this will look at is how we in fact prevent this. So how are you going to prevent people from getting exposure? What are their plans? So we're going to run through a case and then an example of this so you can see how to use this in action. So we're going to start off with this case of surrounds wildfires. So thinking about wildfires through a health lens, all these pictures are of the impressive fire we all saw in the news, probably of New York City. That wildfire caused the worst air quality in New York City that's ever been recorded. Those were caused by wildfires in Canada. And just for reference, 13 million acres of wood, forests were burned in Canada so far this year. Last year, the whole year, they only burned 140,000. So 13 million to 140,000 is quite an impressive number to understand where all this wildfire is coming from and the wildfire smoke. So very significant with climate change. We're seeing these increases of wildfires causing this horrible air quality. The lower map of the United States on the bottom shows kind of the areas that were affected. So I think this is a very timely topic for us today. So the case we're going to be focused on today is Miss Washoe. She is a 42-year-old Hispanic female who comes to your emergency department here for refill of her asthma medications. She recently had to flee her home due to wildfire and has had to use her albuterol inhaler 4 times a day, and she is now run out. She left her salmeterol fluticasone, aka Advair, at home and has not been able to use it for 5 days. She's unable to reach her primary care clinician due to the fire. Their office has been closed. So her current medical history, she has been using her albuterol rescue inhaler 4 times this past week. She has had more wheezing on and off during the day. It is worse when she is outside and when she exerts herself. She's waking up coughing, but she is not sleeping well due to her nightmares after driving through the fire. Her past medical history, she was hospitalized for asthma 3 times in childhood, but not in her adult life. Her medications include the Advair we talked about, also called fluticasone salmeterol 50/250. She's on albuterol inhaler. She also has medications for hypertension and chronic depression. Her family history, her son has asthma, her mother has type 2 diabetes and hypertension. Her social history and support system, she lives with her husband and 2 children. who are now staying at her relative's home in Las Vegas due to fire. She has never smoked cigarettes, vaped, or used other substances. She works as a housekeeper and she's staying in a temporary shelter in Las Vegas. She's also working at a hotel trying to help keep it open, and that's primarily used for relief workers. She has no other allergies. So I'm going to ask everyone in the chat, let me go back a slide, to think about any other questions you would want to know about this patient, given her history with the wildfire smoke, and anything else you would want to know. If you'll just type it in the chat, and then I'll hand it over to Dr. Leovi.
Thank you, Dr. Ursuline. So we have this patient who's presenting to our emergency department with signs of and symptoms of uncontrolled asthma. And we've taken a pretty good traditional history so that we understand her personal situation. So let's take just a moment to think about how we would apply those principles of environmental history to her case. How do you think about her in terms of that CH2OPD2 mnemonic, about her risks of community, home, hobbies, occupational, personal, diet, and drugs? So here are some of the things that Dr. Ursuline and I thought about when we incorporate the environmental history into her assessment. In terms of her community, it might be important for us to know, are there other sources of pollution? We know that wildfire smoke pollution can interact with other sources and be additive and further aggravate asthma. And since she's been displaced, we want to know, how is her community in terms of, do they have an organized emergency response plan? Is that known to the community members? What supports are in place for people who might have been displaced by the wildfire? In terms of her home, again, we want to know if she has to evacuate, is her home built with some fire resistance? Is it accessible? Is it easy to evacuate? If she doesn't have to evacuate but has to shelter from smoke exposure, is the home well insulated? Is there central air conditioning, which is very important for protecting people from smoke? Are there smoke and carbon monoxide detectors? Hobbies, maybe not so important in the case of wildfire, but certainly if she or her family were doing a hobby involving toxic or flammable materials, that might be important to take into consideration. Occupational considerations are really important, especially if the patient's an outdoor worker or a first responder. In this case, we know that she's a housekeeper, and therefore she might have chronic exposure to dust and cleaning chemicals that again can be additive to the smoke in terms of exacerbating her asthma. You can go ahead and forward. Thanks. And again, and forward again, forward again. In terms of her personal situation, we already learned that she does have some chronic health conditions. She has hypertension and she has a depression and may be on medication for those. So we might want to take a minute to think about how her asthma exacerbation and her displacement would feed into possibly worsening those other health conditions. Very importantly, we need to understand social determinants of health. We need to understand if she has a language barrier that might impair her ability to respond or seek care, if she has financial or social barriers to evacuation or to getting rehoused. If some of her family members have special needs, she might be having to deal with that in addition to her own health concerns. And what we know from disaster response is that we always have to consider people's pets. People often will not want to evacuate from any kind of emergency without having a plan for their pets in place. Since she's living in a shelter, does she have any food restrictions or special dietary needs? And does she take medication that might increase her risk to a climate disaster? For example, we know that anticholinergic medications, that includes many different medications, including antidepressants, allergy meds, and others, impair the human body's ability to respond to heat. Other medication could also increase her risk. If she's taking a diuretic, for example, that might impair her ability also to respond to heat. And we already see that one of the reasons she's in our emergency department is because she was unable to fill her asthma controller medication. Let's think for a second about what the impacts might be if she were unable to refill her depression or high blood pressure medication. How might that impair her ability? So this is just a little glimpse into how we can think about a broader history taking in terms of somebody's environmental history and apply that to climate-related health concerns. So thinking about wildfire specifically, we know that every type of climate impact, and Dr. Watts mentioned heat and air quality and storms and floods and many other things, every climate impact has different health risks. In the case of wildfire, deaths are not so common, but we have both acute and chronic problems that do come into play. Especially for first responders, we might have to worry about inhalation lung injury and burns. For everybody in a wide swath exposed to smoke, which can be hundreds of miles, we have to worry about aggravating respiratory illnesses like asthma and chronic obstructive pulmonary disease. Especially for people close to the line of the fire or people who are forced to shelter in place due to smoke, we have to worry about mental health effects. And mental health is impacted with many, many different climate problems. I'll talk in a minute a little bit about perinatal effects. But one thing I think it's important for us to understand is that we already live in a country that has lots of health disparities. Some people, due to access to health care, due to socioeconomic, education, language, and other barriers, are more at risk for serious health consequences. And wildfire might exacerbate those. We just talked about if somebody has a language or financial barrier, it might make it difficult to evacuate or become rehoused. If somebody has chronic diseases or is elderly or disabled, it might make it more difficult for them to be in a shelter. So wildfire is a good example of how climate change is a threat multiplier to other health problems. In terms of perinatal effects, we really need more data. We don't have a lot of data, but there are some studies that link exposure to wildfire smoke and directly exposure to wildfire to preterm birth and low birth weight. Dr. Watts talked about those particulate pollution that's part of wildfire smoke, and we know that even in the short term, it can lead to retarded fetal growth and preterm birth. And those fine particulates may possibly increase the risk for autism spectrum disorder, although we don't know that for certain. And we all know that healthcare is expensive, and we need to consider the cost of healthcare when we're talking about any health impacts. This study, published in 2018, looked at wildfire risks across the U.S. and found that, of course, that are highest in the West, but also in the Southeast, there can be a risk of fire. And now we've seen just this year that the upper New England and the East Coast had serious smoke effects for a few days. So this study, looking at the years 2008 to 2012, which was before many of our serious wildfires of the last few years, showed that just short-term exposure to wildfire and smoke costs the health system $11 to $20 billion a year. Mostly that was for treatment of respiratory and cardiac problems and hospital admissions due to those problems. Some of that was cost due to lives lost. And that, again, as Dr. Watts mentioned, reinforces the need for hospitals and health systems to really think about whether they are considering wildfire risk and resilience planning. So as part of disaster planning, we should think about wildfire risk. So as an example, if you're in the Reno Tahoe area, you likely remember the Caldor fire that occurred 2 years ago and caused evacuation of all of South Lake Tahoe, a major tourist area along this roadway with bumper-to-bumper stop-and-go traffic. That evacuation was very frightening, I think, to a lot of residents in the area. Now imagine that Barton Memorial Hospital that's located in South Lake Tahoe, at the same time as all the people in town were evacuating, they had to evacuate 63 inpatient beds and 48 skilled nursing beds. Imagine trying to do that. Patients had to be sent to neighboring facilities, they had to find beds in other places, and they had to figure out where to set up a temporary emergency department on the fly, and they did that in an outpatient surgery center in a nearby town. So that highlights how difficult it can be for a small hospital or a small health system that's forced to respond on the fly. So people working in hospitals and health systems, this might be an area where you might want to think about. Are you familiar with your systems resilience plan or disaster planning? Maybe that's an area that you can be involved with. So now we'll turn a little bit to public health response. And nurses and doctors and other health professionals know that we need to know this for our patients, and if you're working in public health, for the population, but also all of our friends and family and people we know are always asking us a bunch of health questions, and so it's good for us to educate ourselves. So let's just take a look and see if we can make this YouTube link work and watch this quick video about what to do in case of evacuation. I don't know if the volume is going to show. I don't know if you can make the volume go, Dr. Ursuline. All right. So reviewing the information, some of that information, and adding a little bit to that, some of the things that we might ask our friends, family, patients, and community to think about would be making an emergency plan. If you have to evacuate in the middle of the day, how are you going to get your family together? What are you going to do with your pets? Can you put your important documents in a place where they can be grabbed in case of evacuation? Strengthening your home involves ways to help it not burn in case of a fire. We'll talk about that in a minute. Know how you might evacuate it, what's the route, and how do you find your zone. Have a to-go kit and include extra phone charging batteries. It used to be that we thought that in the West and particularly in the Sierra that the wildfire season was in the summer and fall, but now we know that we almost have to think about wildfires year round. So some of the ways to prepare homes, sealing windows, having good windows, and there's now money under the federal government legislation that was passed last year to help make homes more energy efficient and better sealed, which is good for energy bills and also good in case of smoke exposure. Have a smoke detector, an escape route, a to-go kit, some means of hearing communication so that you can hear instructions. And of course, we should be aware of what is our community's response plan. How do we get emergency alerts? How do we know what evacuation zone we're in? It's said that if you're in a home that's supposed to be evacuated and you're unable to get out, keep the lights on and call 911, and that helps firefighters and responders find you. In terms of smoke exposure, we all need to know how to deal with this now that we have smoke risks in almost the whole country and certainly throughout Nevada. Luckily, most of the public is familiar with using a K95 or possibly an N95. There is a way in houses that don't have central air to close off a room and use a box fan with a filter to make a portable air cleaner, and there are some YouTube videos about that. So I hope that gave you just a overview from direct patient care to a public health response about what we need to think about in terms of wildfire, just one of the health risks, but one of the major ones. And I do want to put in a plug for Nevada Clinicians for Climate Action. We need nurses. You know, nurses are the most trusted professionals in the country. Doctors, I think, are around number 4, but nurses are highly trusted, and we really need nurses to be involved and speak out about climate change. So Nevada Clinicians for Climate Action welcomes nurses, doctors, and any health professional, anybody that works in a hospital, anybody who's a learner or a student or a retired health professional, to help use our trusted voices to bring some attention and remedies to this issue. One more slide. So some of the things we do, we work on policies to reduce emissions. We work on resilience, cooling centers and wildfire resilience, both in our health systems and our community. We educate the public and other health professionals like we're doing today. We do advocacy. So one of our student members was at the legislature introducing a bill recently, and we'd love to have you join us. Thanks so much. I'm going to pass it back to Jessica.
Thank you both very much for that. That was a lot of really great information and super easy to retain and put to practice within whatever area of nursing we're all working. I'm going to pass it over to Melissa Ramos now to finish this out before we go to a question and answer session.
Thank you, everyone. Thank you so much for joining. Can someone just confirm that you're able to see my slides, please?
Yes, you're not in presentation mode, but we can see your slides. And that looks great.
Sorry, one second. All right. Okay, so thank you so much for joining us today. I'll be providing a little bit of an overview of how air quality is here in Nevada and how transportation electrification could be a measure to mitigate the health harms that are caused by climate change. If you're not familiar, the American Lung Association releases an annual State of the Air report, which is essentially an air quality report card, and it tracks our exposure to 2 of the most widespread and harmful air pollutants. This is, you know, we look at 2 of the most widespread harmful air pollutants: ozone, which is more commonly known as smog, and then particle pollution, which is more commonly known as soot. And so we look at states and counties with air quality monitoring data, but it is important to note that not every county has air quality monitoring data. So at the Lung Association, we also advocate for increased air quality monitors across the country. And then on our website, on our State of the Air website, we have 3 different lists, and it looks from the most cleanest to the most polluted places to live in terms of these different categories of pollutants. I'll briefly go over what these 2 pollutants are and some of the sources that they come from. So particle pollution is a mixture of different sources from construction, dust, pollen, as well as fossil fuel emissions that are coming from diesel exhaust. This is looking from trucks, factories, wildfires, and wood stoves. And so again, this is more commonly known as soot, and the way I would describe it is during wildfire season, as previous doctors were mentioning, if you were just to wipe your finger like on a windowsill, that black stuff that you pick up, that's soot. And then ozone pollution is more commonly known as smog. I'd like to describe this as just kind of like the gray, hazy skies that you see, especially during the summer. This comes from a mixture of different sources, mostly that come from vehicles and energy and other emissions. that react with direct sunlight, creating that ozone smog in the atmosphere. And so looking at these two widespread pollutants, our State of the Air report finds that approximately 120 million Americans are breathing in unhealthy air. So this translates to about more than 3 in 10 Americans, living with unhealthy air. And this burden of air pollution is, disproportionate because we know that people of color are impacted at a greater level and often bear the brunt of our air pollution burden. In fact, people of color are 3.7 times more likely than white people to be living in a county with failing air quality for all 3 categories of pollutants, including ozone, short-term particle pollution, and annual particle pollution levels. And I won't spend too much time on the health effects of air pollution because I think it was covered kind of in the beginning of the presentation, but some of the health harms that we see with air pollution includes difficulty breathing, coughing, wheezing, and other cardiovascular issues such as heart attacks, strokes, premature death. And so there's a wide array of respiratory and cardiovascular impacts that we see caused by air pollution. And so I will note that the purpose of the State of the Air report is to show that the Clean Air Act is working and it has been working, but climate change has made the progress of clean air much more difficult. And so we need to see stronger pollution controls for energy and transportation so that we can make clean air a reality for all people, especially here in Nevada. So here I provide the rankings for 2 of our most populated cities here in Nevada, Las Vegas and Reno. And as you can see here, both of these cities are among the top 25 most polluted when it comes to ozone and or particle pollution. And so this refers to the unhealthy spikes over a 24-hour period in particle pollution days. And so most notable in this year's report were just the significant increases when it comes to particle pollution. And we saw that nationwide. It wasn't just here in Nevada, but nationally we saw that particle pollution increased significantly, and this is largely due to wildfires, especially in the Southwest states, including here in Northern Nevada. And so I've provided here a snapshot of the report card for Nevada, where you can see that the majority of the counties received failing grades for ozone and particle pollution days, because we're seeing that these unhealthy days are causing more health risks for vulnerable populations, for all people, but especially vulnerable populations who are more at risk from the health harms of air pollution. And so, as I mentioned, everyone is at risk when it comes to air pollution, but there are certain groups who are more vulnerable to these outcomes, including children with asthma, people with COPD, heart disease, pregnant individuals, and then people who are from lower income or non-white populations, because they often also have other underlying health conditions, which makes them, again, more susceptible to the health harms. And they may also lack access to care, making it more difficult to receive treatment in times where air pollution levels may be higher. And so here I have the breakdown of Clark and Washoe, again, our 2 most populated counties here in the state. And so you can see these different population numbers of the people who are at risk from air pollution burden. So I really want to take the bulk of this time to just talk about how advocacy can be used as a tool when we're looking. We have all these different resources talking about climate change health effects, specifically air quality, as a challenge here in Nevada. And so what now? What can health professionals like yourselves do to take advantage or to use your credentials and really take advantage to make a change here in Nevada? And so I'll start by saying that this legislative session in Nevada, the American Lung Association led a report of public health organizations to support Assembly Bill 184. This was sponsored by Assemblyman Howard Watts. And this legislation essentially would create a Nevada Clean Truck and Bus Incentive Program using federal funding from the carbon reduction program. And so this is going to be using about $4 million a year from federal funding, and it's aimed to reduce climate pollution from our transportation sector. We know that trucks generate the greatest sources of unhealthy emissions on our roads, but they are actually the smallest number of vehicles on the road. So through this incentive program, we're going to receive the biggest bang for our buck, because by transitioning, these fleets to zero emission, we know that there are going to be less emissions out into our atmosphere and fewer of those health harms associated with transportation pollution. And so I will share in the chat. I can actually share right now, but there was a significant amount of support from health organizations. Are you able to see this? Some of the health groups that were signed on? I'm not sure.
Yes, if you
Yes.
scroll a little bit, we can see.
Okay, great. Well, I'll just show their logos, but we got significant support from health organizations across the state, including the health districts in both Southern Nevada and Washoe County, and some of the groups that you are on today, such as Annie and Nevada clinicians. And so there was overall an overwhelming support from health groups. And so we were able to have health organizations or health agencies be prepared to testify at the legislature, in support of this bill. And I'll drop these links in the chat. But it passed unanimously out of the Senate. I just realized my camera was not on. Apologies. It passed out of the Assembly unanimously, and then it got mostly support from the Senate. I think only 2 Republicans opposed it, but ultimately ended up getting signatures from Governor Lombardo on June 3rd, or June 10th, I believe. So I put everything in the chat for you to take a look at, but this was just one way of a policy that we were able to support to clean up emissions from the medium and heavy duty sector. And one of our key reports, delivering clean air, showed that if we were able to transition our vehicles to zero emission and on a clean energy grid, we could see $5.2 billion in public health savings between now and 2050. And so I will mention that right now the American Lung Association is looking to host a workshop, media training for public health professionals to kind of get you all started in advocacy. I think the question I hope that you guys are asking yourselves is where do you go from here as health professionals, and how you can start getting engaged in advocacy work here in Nevada. And I think one of the greatest tools that we can do is get prepared on media training, because that's going to give you the tools that you need, not only on some of our key reports like state of the air, but as well as some of our electric vehicle reports that I didn't really get too into detail here, but we have about 3 different electric vehicles reports looking at the benefits of clean trucking, clean vehicles, and then one that looks at, both. And all of that also considering that we would see a non-combustion energy grid. So these media trainings would equip you with all you need to know on these different reports, and then how you can speak, be a media spokesperson, whether it be for interviews, op-eds, LTEs, and also be prepared to testify at the legislature or other state agencies when they're considering these different type of policies. So I'll be sure to drop my contact in the chat, but you can also reach me at melissa.ramos@lung.org. So thank you so much, and I'll pass it back over to Jessica.
Thank you so much again, and thank you to all of our presenters for the wealth of information and the background, and most importantly, the ways that nurses and health professionals can get involved and advocate for our communities and for health in the wake of the climate crisis. So I just wanted to take the last little bit of our time and get into a couple of questions for you all. I know we've all mentioned the importance of taking this information that's presented to us and turning it into advocacy steps. I guess I would start back with yourself, Melissa. If nurses had questions or what are some places or some ways that they can learn more about legislation that's happening and the effects and the impacts specifically in relation to Nevada?
So we have, and I dropped the link as well in the chat for this, but we have a network of health professionals for clean air and climate action. This is a national newsletter that goes out to health professionals across the country, and it'll alert you when there are current petitions that you can easily sign on with your credentials or as your own individual in support of different advocacy opportunities that are occurring at the national level. And then this newsletter is also used when we have local advocacy efforts. So when I'm looking to get more health professionals signed on to one of our state petitions, I go through this newsletter and look for people who live specifically here in Nevada and reach out to them there. So I think the first step I'd recommend is definitely signing up for that national newsletter, because it's going to get you plugged in to the Lung Association overall. And then our local staff can also reach you that way too.
Thank you. And I would say similarly with the Alliance of Nurses for Healthy Environments, folks that frequent our website and click on one of the tabs on the top of the website, the Take Action tab, along with the News tab on the website. There's a really great area to learn about what are the latest things that are happening on a national level in terms of proposals that are coming out from different agencies within the administration, and sign-on opportunities, petitions that our organization has ongoing. Dr. Ersland or Dr. Leovi, do you have anything to share in terms of Nevada Clinician for Climate Action resources that might be available to members who want to get involved in on a more personal level?
I think this is really a great question, and it's really difficult because it's really outside of the box of what most of us are trained to do and think is our role. And so, we're all trying to work directly with patients and be accountable to the patient in front of us. But the crisis of climate change is so great that if we're not thinking about the larger picture, we're really kind of missing the boat. And so, Nevada Clinicians for Climate Action is organized under a broader organization called the Medical Society Consortium on Climate and Health, and they have a wealth of information and ways to get involved similar to ANHI. And our state organization is working on organizing ourselves and developing some strategies for how we can be most effective. I think that one thing that Dr. Watts mentioned is thinking about how to get involved in your own school or workplace with sustainability issues. Get in touch, find out if there's a green team, a sustainability team, find out what activities are already happening and plug into those. That's a really local way of getting started.
Absolutely, I could not agree more. Another conversation that we have often in terms of education is speaking with your professors and finding a way to get more of these educational opportunities embedded in the curriculums in schools of nursing, schools of medicine, all of those things, so that folks are aware, not just when they're practicing, but at the beginning of their health professional education. And we'll be sure to share the website for the Medical Society's Consortium on Climate and Health for folks who are interested in getting involved in that national campaign as well. Did anyone have any final thoughts that they wanted to share before we finish out this hour? Well, again, I very much appreciate all of your time. Dr. Leovi, did you have anything you wanted to add?
No, I just wanted to say I appreciate this opportunity for physicians and nurses to kind of gather together and work in concert on an issue like this.
Absolutely, I could not agree more. One final initiative that we're working on here at ANHI as a part of the Solutions for Pollution campaign, which is a national effort to reduce climate warming pollution from various sectors across the country, kind of like what we've discussed, what all of our presenters have discussed throughout the day. The Environmental Protection Agency announced last month a proposal to reduce carbon pollution from fossil fuel, coal and fossil fuel, powered plants across the country. So we do have a petition that we are circulating on that. I'll be sure to drop that in the chat as well. So again, just one small action step, somewhere that you can add your name and your support to support a transition from fossil fuels in this country and to help address the climate crisis. So thank you to folks who have tuned in. And again, we will be sure to share the link for the post test for folks who are interested in applying for continuing education credits as well.